Alright, so we're going to continue with heart sounds. Since we finished apical pulse, we're going to go over heart sounds this morning and then go into respiration. I always have to look back and make sure they can see me, or if I'm in good view. Again, don't make fun of my fish. And yes, those of you at home, you need to write these down. Some heart sounds. So first we have our clavicle and our heart, like we did with the apical pulse, so nothing different. And then you have a mnemonic that goes along with the heart sound. A, head, monkey. And that's A, head, monkey. And you say, what does that mean? These are the names of the valves of the heart, at which point you're going to hear the heart open and close, the valves open and close in the heart. So A is aortic, P is pulmonic, E is Erb's point, T is tricuspid, M is mitral. The last one being mitral. So the way that you would listen to the heart sound is you're going to come on the right side first. Now, no, your heart is not on the right side, but you can hear the aortic valve on the right side. So it would go aortic, pulmonic, Erb's point, oh goodness, I have brain, Erb's point, tricuspid, mitral. Okay, so I'm going to get my stethoscope and show you this. So with your stethoscope, it would be aortic, pulmonic, come down, Erb's point, tricuspid, mitral. And mitral is on the side. And I need to bring it down on the side. Now, as we talked about with apical pulse, it's the same with the heartbeat, that you have to keep in mind the patient's privacy, especially someone that's busty, female, or in general. Some men are bashful and they don't always like to have their chest exposed. Women tend to be a little bit more open, especially older women and younger females or women that are of childbearing age that have had children. They typically don't care, but you still need to respect their privacy regardless if they have a preference or not. So that is how you evaluate the heart sound. I'll let you do one with the respiration. And so now we're going to switch over into lecture to do respiration. Respiration is taking in oxygen and expelling carbon dioxide. So that one inspiration is one breath in, so inspiration, and one out, expiration. One cycle is called one cycle respiration is when you breathe in and out. Now this entire slide is nothing but definitions. So please make sure that you are familiar with them. Rhythm is the equal spacing between breaths. Character is the depth and quality of respiration. Orthopnea is shortness of breath when lying down. This is common with people who are overweight, and this is also common with people who have heart disease or heart condition, because their body is already having a hard time pumping through the heart, be it that it's damaged, so they're having a hard time while they're laying down. If you've ever noticed some of your relatives may sleep sitting up, this could be one of the other issues that causes that. Now, is it the only one? Absolutely not. But if you can't sleep while you're lying down because you can't breathe, that's a serious issue. Dyspnea is difficult or labored breathing. Several of you complain that you're old at this age, which you are not. Oh, miss, it took me forever to run up those stairs and I'm tired, so you're breathing really hard. That's difficult or labored breathing. Apnea. Apnea is the temporary cessation of breathing, especially during sleep. So the person stops breathing. They can stop breathing anywhere from 10 to 12 seconds, sometimes even 30 seconds. That's 30 seconds that the body is not getting enough oxygen to the brain and throughout the body. If you've ever heard of a condition called sleep apnea, this is where people are asleep and they stop breathing in their sleep, but then their body remembers, oh hey, I need to breathe, and it'll start picking back up. But it leads to other health illnesses, and fatigue being one of them, because the individual doesn't get enough rest. In order to treat apnea, sleep apnea, you use what's called a CPAP machine, and it alerts, or it detects when the patient stops breathing, and it starts to breathe for them. Again, definitions that are associated with respiration. Tachypnea, fast breathing, is abnormally rapid breathing rates above 25 breaths per minute. Do not get breaths and beats confused. Make sure that you're reading the question, because you can easily get confused by saying beats per minute when it's breaths per minute. Bradypnea is an abnormally slow breathing rate, and that's below 10 breaths per minute. Rales are a bubbly or noisy sound caused by fluid or mucus in the air passages. It sounds like gurgling, literally, when you listen to the person's lungs. we are listening to right now are lung sounds that are rails, which is the definition that you just wrote down. Excuse me, thank you. Next is Cheyenne-Stokes or Cheyenne-Stokes. It's a respirations period of dyspnea followed by periods of apnea. It's frequently noted in the dying patient. Wheezing. Wheezing is difficulty breathing with a high-pitched whistling or sighing sound. Are you familiar with a condition that has wheezing? Wheezing is associated with asthma. And lastly on this slide is cyanosis. Cyanosis is a dusky bluish discoloration of the skin, lips, and or nail beds as a result of decreased oxygen.
If you're studying medicine, then I'm sure you feel like you're supposed to give up your social life in order to get ahead. Because look, I know I felt that way when I went to school in 2010, which is really a decade back at this point.
Good morning everyone and welcome back. Today we'll be talking about Cheyne-Stokes breathing pattern. It can be caused by anything that causes cardiac damage, mainly endocarditis and rheumatic fever. When there is cardiac damage, the blood flow is disturbed. This causes irregularities in the carbon dioxide levels, which in turn affects the breathing center in the brain. We see it mainly in deep sleep or comatose patients. Cheyne-Stokes breathing pattern is described as a period of apnea, followed by gradual increase and decrease, and another episode of apnea. And here's how it sounds like. In most cases, treating the cardiac cause resolves the pathology. But if it persists, however, CPAP can be tried. Cheyne-Stokes breathing pattern is included in the Channels app, along with Cosmos and Ghost breathing patterns. The app contains the audio files for these breathing patterns, along with pictures, causes, and descriptions. This is incredibly helpful for revision. You can download the app using the link in the description. Alright guys, that's all I have. Hopefully this helps, and I'll see you guys later.
Never skip trash day.
You can see the peripheral cyanosis in the fingers, meaning it is in the extremities. This young lady here has a blue tinge around her lips, and this baby has a blue tinge on the tongue as well as around the mouth. Alright, so we're going to write out our respirations diagram so you'll know where to place the stethoscope in order to listen to your lung sounds. So I always get the question, well, Miss, what about when they listen to my back? They're counting your respiration. So just like we learned how to count pulse, 15 times 4, you're going to do the same thing when it comes to respiration. Your breath sounds, 15 seconds times 4. You already know what tachypnea is, and you already know what bradypnea is, and what you should and should not have. So that's how you would calculate your respiration. So let's draw our shoulder blades or our scapula. And then we're going to come across here, make our imaginary line. And this is T7. What does the T stand for? What region? No, what region? What region of the spine does T stand for? The T stands for thoracic. So for the thoracic region, you have T7. That is the 7th vertebrae in the thoracic spine. Why is that important? Because that's where you're going to stop with your breath sounds. That is a landmark, an anatomical landmark where you're going to stop with your breath sounds. In females, you can count to T7 or use the bra strap. Because the bra strap typically stops at T7 when you count down. So let's get by and show you in relation to what that means. No, y'all gotta see. Y'all gotta see Bob. Okay. So what does that mean? So this one that's sticking out right here, this is C7. So for the cervical spine, the one that sticks out the farthest is C7. So then you count down 1, 2, 3, 4, 5, 6, 7. 7 is going to line up with the tip of the scapula. 7 is going to line up with the tip of the scapula. So when we're listening, we're going to go opposite, diagonal, if you will. So 1, 2, 3, 4, 5, 6. That's when you're listening. Because we don't go any lower, and then it'll start becoming difficult to hear. Any questions on that? So if I were to ask you, where do you listen? Where do you listen on the lungs? You will simply mark the 6 X's here, in between the shoulder blades. Now, why wouldn't you listen on the shoulder blade? Why wouldn't you listen on the shoulder blade? Hmm? Mm-mm. What is the shoulder blade? Correct. The shoulder blade is a bone. So we don't want to listen on top of that. So you're going to come in between the shoulder blades, start at the top, near the neck, and we're going to go 1, 2, 3, 4, 5, 6. Now, if the person is a little bit bigger, you might have to go 6, 7, or 7, 8. Most of the time, you can get your breath sounds in the 6 areas between the shoulder blades. Now, how do you count respiration? Again, it's the same way that you do your pulse, 16 times 2. But what are you watching? When you do respiration, you're watching the patient's chest go up and down. But remember, when you count, you have to watch them breathe in and out. 1. In, out. 2. In, out. 3. So on and so forth. That's how you count the respirations. 1 in, 1 out. 1 inspiration, 1 expiration equals 1 cycle of respiration. So let me move out of the way so you can see the body and how you would designate the lung sounds. So for those of you at home, I will either record with another teacher for you to see where you actually put the stethoscope, or I will find a video to post for you to see, because unfortunately I cannot show other students in my video unless I would have them demonstrated for me to do with you. So for right now, just hang tight and use this as your guide until I'm able to post an actual video of the procedure itself. So note that when you do respirations or any type of auscultation, auscultation means to listen. And any type of auscultation that you do, it should be done skin to skin. Simply because if you try to do it through clothing, you're going to get artificial sounds. The rubbing of the clothes is going to give you a false reading. And I can tell you just from experience that if you try to listen to someone's lungs, you're going to always diagnose people with asthma. Or you're going to always tell them, oh, you're wheezing. No, it's the shirt or the blouse that's rubbing against the diaphragm of the stethoscope. So it's always a good idea to make sure that the patient is gowned so you can listen skin to skin, or you make that establishment that you're going to go under their shirt, or that you have to go under their shirt so you can get a better listen for the lung sounds, or even the heart. I typically have my patients gown first. That way they can feel secure, a little bit secure and private because they have a gown on, or I use a blanket, depending on what the situation is. But again, always make sure that in best practices that you practice skin to skin. The other important part of taking vitals is that you need to be in an environment that's quiet, because noise in the background also distorts your readings, whether it be blood pressure, vitals, heart sounds, it doesn't matter. So being in an environment or a room that's quiet is ideal for taking vital signs.